Hey guys, Colin here at the Deep Tissue Massage Center, and I want to show you a kind of unique stretch today for your hip. Now, for some people, they end up getting a pinch in through the front of the hip, specifically at the top of the thigh here. And when you tend to either lift your knee toward your chest, you'll get a pinching sensation, lifting that knee up. Or when you tend to cross one leg over the other, you'll get pain in the groin here. So this is indicative of something called FAI, or femoral acetabular impingement. And all that means is that the head of the femur, of this thigh bone here, is supposed to sit in the acetabulum, its socket, and it's supposed to be centrally located so that it can slide forward and back and have enough room to do that, because you're going to bend your leg one way and then the other way. Because when we walk, I lift my knee up and bring my foot forward, and it has to go behind me when I'm pushing off that back leg. So that movement has to have enough space. What happens for some people when they get this jam in through the front of the hip is that the head of the femur gets shoved forward and doesn't have space to be able to rotate and glide the way it needs to. So I'm going to teach you a few different exercises, stretches in specific, that you can use that pretty quickly start to turn this thing around. Now, the test for yourself is going ahead and bringing your knee up toward your chest and seeing at what point you start to feel the pinch here, some nerviness. You might get weakness in through the front of your thigh a little bit, and then crossing your leg if you tend to have that groin strain. At what point when you cross your leg do you start to get that? Does it have to be really crossed way over, or is it as soon as you bring your knee in toward the midline of your body? So these are the things that you can use to assess both before and after you do these stretches. Okay, so we're going to start out on the mat. You want something under your knees so that you're not touching or pushing pressure into a hard surface. What we're going to do is get in a quadruped position. That's on all fours like this. Your hips should be stacked on top of your knees, your shoulders stacked on top of your wrists. In this position, you want your back to be fairly flat, so you might have to bend your front elbows a little bit just to get that flat back. You don't want to be arching the back or letting the belly drop way down. And first thing I'm going to do, I'm going to slide forward just a little bit here, is I'm going to be working on this left hip. So I'm going to take this right leg and straighten it out behind me, like so. So in this case, I'm kind of pushing it against the wall. You don't have to do it against the wall, but just have it straight behind you. So now the majority of my weight is on this front knee, but my weight is still kind of evenly balanced between my shoulders here. Now in this position, what I want you to do is notice how much you have a tendency to want to grip around the top of this hip or through the hip itself to kind of protect that hip, especially if you're having that pinching. There's going to be a tendency to want to do that. So what I'm going to have you do in this position is just try and imagine that socket and the hip area melting, softening, opening up, and allowing the head of the femur that's now pushing upward to push as if it's going through your glute up toward the ceiling. And you're just going to relax into that the best you can and let that soften, and just hang out here for about 30 seconds and get a sense of what that feels like. And you may start to feel a good stretch just doing this alone. Now, to intensify this, what we're going to do is I'm going to shift my weight more onto my left side. So I'm not going to do that by twisting at the hips or anything and dumping my weight over here. Instead, I'm going to just gently shift my kind of center of gravity so that it's more above this left hand and this left knee. And in that position, I'm going to have you soften that hip again and feel for that pressure in the joint socket, in the hip joint, and see if you're able to soften around that. And again, let that pressure push backwards in through your glute. Now, in this position, you can play a little bit with rocking forward, just a tiny bit, or rocking backward. And you only want to rock backward to the point where you don't have pinching or pain in here. So if you rock backward and you start to feel that pinch or pain, shift forward a little bit. And this will give you a different angle and it will help to continue to open that up. You can hang out in these positions for anywhere from 30 seconds to a minute to a couple of minutes, depending on what your body can tolerate. Now, the next part of this, what we're going to do is put this leg, this left leg and this left femur in what's called internal rotation. So we want it to be, the femur to be rotated inward. So I bring my foot out to the side like this, straighten that back leg again, shift my weight more onto the left side, and let that hip relax. Now, if you're having pain in through here, you're having pinching, anything like that, bring this foot more toward the midline of your body, more back toward the other foot. So you don't want to rotate it out quite so far. There will be a point at which it's going to be uncomfortable potentially. So bring it back. As long as it's rotated out a little bit with the foot, it means the femur is rotating in and we're heading a different direction. Now, again, you can hang out in that position 30 seconds, a minute, whatever. Now, the last thing we're going to do is now bring this femur into an internally rotated position, which means I'm going to bring my foot underneath me here, and I'm going to drop this back knee just to kind of block that foot in that position. And again, I'm going to shift my weight over toward the left. I'm going to let that hip relax and soften. I'm going to rock back a little bit, not to the point of feeling pinching, but just to change the angle a little bit. And just experiment as I rock back and forth a little bit, forward and back just a bit, what angle I feel the best stretch at. And I'm going to hang out in that again. So in essence, what we're doing is we're shoving the head of that femur, we're gliding it back in the socket, and we're also encouraging that femur to be able to rotate inward and outward and creating space for those positions too. So when you get up from this, go ahead, retest, bring the knee to chest, crossing the leg over, and see if it doesn't feel when you get up and start moving around. If you have some more space, you should have a sense of more space in that hip to move. And this would be the sort of thing you would do every day, sometimes twice a day, if you're having a lot of this pinching or if you're sitting for long periods of time. And at a certain point, that head of the femur is going to move back enough that you're not going to have that sense of pressure or pinching in the hip.